Good afternoon, everyone, and welcome to our webinar, Enabling Improved Healthcare Outcomes Through IT, Insights from TBR's 2Q13 Healthcare IT Services Vendor Benchmark, highlighting the results from our recent HITS benchmark. My name is Allison Crawford, and I will be your host for today's session. Over the past few quarters, we've engaged with our readers to bring deeper clarity into the state of the healthcare IT services market. We've had good questions and discussions with you as a result of these events, and we're excited to continue to connect with you as the HITS practice grows. In the next 30 minutes, Analyst Joe Walent will delve into the trends driving the results featured in this quarter's benchmark, followed by a Q&A of these trends and how they will affect you. Before I pass this over to Joe, there are a few logistics I'd like to cover. First, we'll be recording today's session and posting it on our YouTube site, TBRI channel. We encourage you to visit our channel to watch this presentation or any of the others that we've posted. Second, we'd like to hear your opinions and thoughts on the materials we're presenting. Please send any questions or comments to the Q&A or chat function. Joe will address them at the end of the presentation, or if you'd like to set up a client inquiry for more detailed discussion, please reach out directly to Joe at the end of the presentation to set up that conversation. Third, we'll send out the slides to everyone registered for today's webcast within 24 hours of the conclusion of the webinar. You can also find the slides, as well as other thought leadership pieces, webinar decks, and commentaries on SlideShare at www.slideshare.net/TBR_market_insight, and we'll share all these social media links with you again at the end of the presentation. Now, let me introduce Joe Walent, analyst on the professional services team here at TBR. Joe is the HITS lead analyst and has been a linchpin in the program since its initial coverage of CSC. His insight into the performance of the HITS vendors is unparalleled in the industry, and his guidance has assisted countless clients with their strategic planning. And with that, let me turn this over to Joe.
Thank you, Allison, and thank you to everybody that's joined us today. Just jumping right in, I'll give you a little background on the HITS practice here at TBR. We cover 18 vendors in our benchmark. We also have a qualitative analysis on one vendor that is considered a quiet company, given it doesn't report on a regular basis, its financials and the like. Additionally, we cover 12 of those companies with either quarterly or semi-annual reports, so we delve a little bit deeper into them, and that's under our regular vendor IT or professional services practice. And then finally, we have 5 healthcare-specific IT services company reports, and we're looking at CSC, Dell Services, HP Services, IBM Global Services, and Accenture, and those are on a semi-annual basis as well. And then we have the list of the companies that we're covering in the benchmark from a quantitative standpoint. But we'll just jump right in. We have 3 major themes that we observed in the 2Q13 quarter, and those were along the themes of geographic, technology, and regulatory. What we were seeing in the geographic was more of the IT service vendors in healthcare are looking to the emerging markets as areas of growth and to sustain margins in many respects. Second was technology. One of the major themes that we saw in this past quarter were more and more companies were stepping into and examining, especially in the conversations we were having, we're reporting that telemedicine was becoming a bigger piece in their overall practice and how they were assisting providers and payers in that area. And then finally, regulatory. And many of the conversations we had with IT service vendors in healthcare centered along the ICD-10 implementation that is less than a year away. So let's get started. We'll jump right in around geographic. So what we've noticed is that the U.S. remains a central area for healthcare IT services, estimated to be about 45 to 50% of the overall HITS market on a global scale. So there's a high degree of competition, market saturation, and we're also seeing that, so healthcare players are in turn looking at developing nations as greenfield opportunities and also to scale and keep their high level of growth that they've been experiencing. So while we're looking at growth, we'll turn to slide 6. Now I'll take a moment to orient you to this chart. It's both the average year-to-year growth for the all 18 companies that we cover in the HINTS benchmark, as well as the average TTM, 12 trailing month year-to-year growth. And in both cases, we can see that there is a general decline, aside from the one outlier that we experienced in 4Q12, where there was some pent-up demand after the election that immediately manifested in that quarter's results. Otherwise, we see it, while the results are strong double digits or high single digits, and this is outweighing and well ahead of what we're seeing in the larger IT services market, there is some need for companies to take advantage of other opportunities to keep a higher level of growth when it's starting to slow down in the major part of the U.S. market. One area that we're seeing that more companies is developing areas of Europe and in APAC, the Middle East as well. So turning to slide 7, this is just another area that we can underline why companies are looking outside of the established markets to recapture strong growth and bolster their existing margin levels. So looking at this, the size of the overall sphere is the size of the health IT services practice in terms of revenue. The position is relative to their margin and to their revenue growth. And we can see that they're grouped primarily in the mid-single digits, low double digits area with some outliers. SAIC and CGI, two of the ones that are showing exemplary growth, but in the case of CGI or in both of them, it's a direct result of them making major acquisitions in the health IT services area. And as a side note, and not to digress too much, SAIC did just complete their split, and in future iterations of this report, we'll be covering Leidos, the piece of the SAIC business that acquired their healthcare IT services business, and we'll be looking at them. Also, CGI, with their acquisition of Logica over a year ago, will be sliding back to join the pack as well after having more than doubled their overall health IT services practice with the acquisition of Logica a year ago. HCL has done this organically. They're investing heavily in pushing out their business, but as you can see from the size of the sphere, it wasn't exactly the largest of the practices out there, and they were able to capture that high level of growth early on. But getting back to our point, they are looking to keep and sustain that strong level of growth, as it is a solid area and has been helpful in the overall global economic downturn. So we'll turn over to slide 8 and look at the top players and how they are faring outside the U.S. Size of their trailing 12-month revenue. We have IBM with the largest piece at over $2 billion, $400 million, excuse me, and then tracing on down. Then with the last remainder of the companies at just under $1.8 billion. So we're seeing that the top players are looking to the emerging markets and outside of the U.S. We've noticed that HP, most recently in 2Q13, captured a deal in Catalonia, Spain. Now, while not necessarily in the emerging market, this is an area that is under a lot of pressure. With the unified Europe, you have more people moving to more temperate climes for retirement, and then placing a greater amount of pressure on the healthcare there. HP is going to help Catalonia with that. They also are going to be working closely with Dubai. There's a healthcare payer that they are stepping in to help with. Furthermore, we have CSC is moving aggressive, or has secured 2 deals with the Ministry of Health in New Zealand. Again, not exactly an emerging market, but it definitely gives them a strong foothold and a referenceable account in the APAC region, which is certainly has a lot of economies that have developing middle classes that are looking for more first world healthcare and levels of response in that regard. So we're seeing those two players. There have also been other examples that we go further into the benchmark, how these companies are looking further into the emerging market and gaining footholds in those accounts to keep that high level of growth going forward. So with that said, we're going to take a look at technology. And particularly, we're going to look at the telemedicine and how that is. Now, that's going to be a significant tool in emerging markets with less infrastructure, wireless communications, and being able to provide healthcare across modern telecommunication methodology will be a definite boon to these companies. So we'll take a look at some of the areas in the U.S. where we're seeing, and some projections that we've done on the adoption of telemedicine here. Now, what we're seeing right now is that it's being tested in some markets, but as the use and the efficiency that it can render for many providers and payers in cutting health costs and improving overall efficiency, as well as the durability of telecommunication networks, we're seeing more and more reasons and projections for higher adoption over the next 5 years. And this is going to be those companies that have established offerings and are able to work with clear partners are going to have an advantage in this market going forward. Now, telehealth is going to be a key area to reduce overall expense for healthcare providers. A lot of users right now we're seeing take place with post-acute care patients, especially for follow-up appointments. This is going to be a key component in the continuity of care, coordination of care that is expected under the new models for accountable care organizations. And having that telehealth piece or the telemedicine aspect, being able to integrate that for provider clients, payer clients, will be a necessary piece for healthcare IT services practice. We're going to see this along, especially in the cases of those chronic healthcare conditions, health problems such as heart disease, asthma, diabetes, and mental health issues is another issue that's in the forefront of a lot of our minds. Increasing the access and touch points that you can have with patients that are suffering from these chronic conditions. Also, you're going to see it at the other end of the scale. So at your more routine kind of healthcare visits where it wouldn't necessarily need an office visit, where a established patient may have something like a sinus infection and has this on a regular basis. They can have that telemedicine conference with their healthcare provider and have that prescription for antibiotics sent along. So this is going to render expense savings for as much as 15% for these routine office visits for the delivery on the provider side. Another area that we're looking into and tracking closely is the legislation that's flowing through many of the states as far as mandating that healthcare payers accept telemedicine as a delivery and that they remunerate for that. So the states that we have here in blue, and we couldn't find a picture of Hawaii, so you'll just have to use your imagination. But these states are requiring that healthcare payers consider any services delivered by telemedicine. The private payers have to pay for that. So we feel that this is going to be added incentive for providers to leverage and pull this lever of telemedicine to both cut costs and increase their ability to serve their patient core. Another area that this is going to come into play, and we expect there's legislation on the table for Florida as well as some other southern states besides Georgia, Mississippi, those in Louisiana, Texas, is that you have populations that normally reside in northern climates that winter in more temperate southern climes, kind of like as we talked about in the case of Catalonia, Spain. Being able to have or maintain that connection with your primary care physician or your healthcare home where you reside most of the year, or maybe in the summer months where you have your medical history, is going to be more possible with telehealth solutions. And we feel that that's going to be, with the aging of America and the baby boomers moving closer and closer to retirement, we're going to have more and more leverage of this new tool, and being able to increase customer or patient base time while at the same time helping to control costs. What this is also going to offer as far as opportunities for HITS players is having the insight and understanding as far as the legal ramifications, and also creating systems that will help track and make sure that reimbursements are flowing through. Another area is that the Center for Medicaid and Medicare is still kind of dragging their feet on this. They haven't completely authorized the delivery of healthcare services via telemedicine. We feel that this is an area that is going to have to be re-examined and passed on, and I think that those players that are already established with the federal government will need to have this in place to help that move along as well. Another area that we think licensing verification will be an area as far as being able to offer services across states, and also for providers being able to attain those licenses. So with that said, and the importance of technology, we'll look at the regulatory piece and how, while it's playing a role in telemedicine, it's also playing a role as far as the overall classification and how diseases are being recognized and tracked in the overall system. And that's part of the regulatory piece that we observed with the ICD-10 take-up. So looking at this, we're seeing that, with the overall massive and intense need to uptake in IT health services for many of the providers and payers, and the virtual tidal wave that they're experiencing as far as regulations that they need to meet, beyond ICD-10, with meaningful use, EHR implementation, complying with the Affordable Care Act. These are all putting a lot of pressure on IT services. So we feel that many of providers, payers, will be looking to IT service providers to further augment their own IT services and help them move and take on this ICD-10 piece, do the groundwork that needs to be done now. We're less than a year out, and the advisories across the board are saying that this needs to be done. There's very little likelihood for a date being pushed back. We really feel that more and more players will need to take a close look at this. Some of the services that are going to be, or other areas, add-on services that we took a look at, and speaking with clients, IT vendors as far as this, are these are going to be areas where the ICD-10 is going to create certain changes, and that providers, payers will need additional care or additional assistance in implementing these new changes. Number one, first and foremost, is going to be the training on the coding changes and having those set up so those medical coders can begin to become much more familiar with the ICD-10. So when the cutover does take place, there's less of a learning curve. And already we're seeing several providers are putting these together and putting them in place for healthcare providers. Another area is going to be as far as revenue cycle management and the changes that are going to be coming about with the change in how reimbursement is coming. So you're not just going to have the requirement for ICD-10, but also with the shift to a more outcomes-based. This is a double whammy in effect, and we see that this is going to be an area where health IT service providers are going to be a trusted partner in helping negotiate through this wide level of change. And finally, the additional ability to auditing for identity of possible fraud and abuse in the marketplace. And with the need to gain efficiencies and to cut overall costs. This is becoming a more and more vital piece. And this is also going to integrate a lot of big data analytics and being able to have real-time analysis of the data that's flowing through. Some of the areas that we're also or one way that we are looking at this is that this is almost similar to the Y2K issue, where you had many of the IT service players were coming to the aid of businesses to identify code, and we feel that this is very similar, and this is going to be a natural fit for providers across the board. There's going to be some separation of duties. There's going to be the larger players are definitely going to be taking care of the super regional and regional healthcare systems and your larger payers. We feel that the mid-market is going to be an area where your Indo-centric players and your other mid-market players in the healthcare IT services space are going to be working with your smaller providers and payers in that regard. And to that end, we're seeing a large amount of activity from the Indo-centric players. So we'll take a look at slide 13, where we've outlined some of the specific service offerings that these companies have brought to market and are looking and are actively bringing out to provider space. So in doing so, they're definitely looking to become, strong players in the space. The take-up in the mid-market is certainly, this is a regulatory piece. This is a zero priority. It has to be done before their #1 priority. We're at less than a year, and with the background of these Indo-centric players, with their access to large amounts of IT talent, they're able to quickly ramp up and take on a wider amount of clients in a short amount of time. So we feel that they're going to be operating very quickly in this space. They're going to be able to be very competitive on price, and this is an area that other players should definitely keep an eye on, as this is going to be a serious touch point where they can deliver for providers and certainly gain significant traction in the marketplace. So with that, we've looked at the top 3 trends that we saw across the health IT services space in Q13. Again, there was, from the geographic standpoint, more providers are pushing into the emerging markets. From a technology, telemedicine is a high area, a high sensitivity area where more players are looking to develop. In many cases, they're forming alliances to have access to greater amounts of IP in the area, as well as tying in with telecommunications companies to have greater overall network access. And then finally, the regulatory piece, with the high-profile movement to ICD-10 taking place in less than a year, and the need for providers and payers alike to convert over to this much larger, more complex system. Some of the areas that we're going to be looking at next quarter we're going to be tracking mobility health and looking closer at some of the specific tools that are being brought to market by our syndication and how they are moving into the space. Second is with the Affordable Care Act, the expansion of Medicaid, and which providers are really working with states as far as to head off and be prepared for this influx of new customers that will be taking on Medicaid. And then finally, with the very current in the news today, but the second piece was also the October 1st opening of the health insurance exchanges and how that's going, and what the overall impact was for many of the providers, how they were moving along with this, and then what their longer-term strategy will be in this space. Further, we're also going to be taking a closer look at our source IT healthcare and areas of the market where both software, services, and hardware are in high demand in the healthcare industry. And with that, I'd like to open it up to questions.
Great. Thanks to those of you who have sent your questions. Now is the time, over to your right-hand side of the screen, either through chat or Q&A to send questions to Joe. Joe, the first question we have is, what are some of the strategies, besides expanding in emerging markets, IT vendors covered in the report are pursuing to sustain growth?
What we're seeing, besides emerging markets, is also the idea of expanding their managed IT services. This is something that providers such as EMC, not in our benchmark, but they're making a play in this area. McKesson has greatly ramped up their managed IT services, both traditional and from a mobility standpoint. We're also seeing the need to find industry-specific cloud solutions that meet the exacting requirements for security in the U.S. for HIPAA and maintaining protected patient data in a wider scope when using cloud architectures. Another area is the improved level of communications and establishing that tools for coordination of care. And finally, also looking at those patient handoffs. So when you have that accountable care organization and that coordination of care, making sure that people aren't falling through the cracks and that you have that follow-up appointment and that true look to generating improved outcomes overall. So we feel that those areas, in addition to emerging markets, are growth areas where health IT service providers are looking to expand investment and sustain or improve levels of growth in health IT services.
The shift to ICD-10 places additional strain on providers from a revenue standpoint. What do you anticipate the longer-term effects to be? From a provider standpoint, with the amount of pressure that they're under, and we kind of touched on this earlier, with the various requirements, there's some providers out there that simply don't have the bandwidth or the resources to accommodate all these areas. And in that regard, ICD-10, with its possible impact to revenue streams, is going to create conditions where TBR believes that there's going to be a rising wave of consolidation in the marketplace. And we feel that health IT services, from an M&A standpoint, will be aiding as far as integrating systems that are already in place and making, much as we saw in the financial services area just a few years ago, where IT service companies were helping aid in the post-M&A integration of these firms. We feel that this is an area where ICD-10 is going to create conditions where you're going to have a period of consolidation in the provider area of the network, overall market, and then you're going to see health IT services stepping in and making sure that they go smoothly. Okay, looks like we had one other question come through. What do you consider to be an underserved area in telemedicine for an IT service vendor position?
One area that we heard about in our conversations was the need for payers to become much more adept and familiar with identifying telemedicine procedures and accurately being able to do reimbursements for those services that are delivered that way, but also being able to have appropriate levels of verification of how those services are delivered. And from that standpoint, we feel that health IT service companies are going to be able to aid a lot of these players in that, but it's really just seeing how it's being adopted for the payers before they're turning and asking for this. So having something ready to go would be a great thing. We're hoping to learn more about how they're building out that area, but we feel that this is one particular area where we could see a lot of investment from your health IT services vendors in the next several quarters.
Okay, another question come through, Joe. Are the EHR software companies, Cerner, Epic, etc., investing to provide more IT services themselves, or are they happy to pass this off to others?
That varies. Now, we don't cover Epic directly, but I know that they are typically not in the business of providing the wider range of health or IT services. From the other side of it, Cerner, they're similar in that way. We see a lot of their IT services revenue that they give is primarily centered around the implementation and management of their EHR system. There's very little push out beyond that. On the other side of the coin, we are seeing managed IT services coming more and more into play for companies like Allscripts and McKesson, where they're looking at that as a additional revenue stream to augment the software that they have or system that they have in place, and also bring the client closer in. So I think it varies from company to company in those EHR software companies that provide services as well.
Okay. Doesn't look like we have any other questions unless someone wants to sneak one in under the wire, because it looks like we are out of time. So with that, I'd like to thank everyone for the questions you sent through, and thank Joe for your time today. As I mentioned, here are all the social media links that you can engage with TBR in conversation, and I encourage you to follow both Joe as well as TBR on the Twitter handles listed here. As you're leaving the presentation, there is a short survey to get feedback on how good we're doing in terms of the webinars, and if there's any other open-ended comments you'd like to talk to us about in terms of areas of interest that we should be covering in our reports. We are taking your feedback very seriously and incorporating it quarter to quarter to bring you more value in these sessions. Just a quick other things, as Joe mentioned, managed services. While it's not healthcare specific, we do have a managed services webinar on October 24th, and so if you'd like to attend that, please do register for that at the TBR events login that you use to register for this webinar. I just got another question. Can we get Joe's slides? Yes, we will be sending out those slides to everyone within 24 hours. So if you need them before that, please send me a direct message. Otherwise, you can look for those in your inbox tomorrow. I'm going to leave the chat function open for another couple of minutes in case there's any last-minute follow-up questions, or if you'd like to speak to Joe directly about what's happening in the healthcare IT market, if you have any specific questions on the slides here, or there's a question outside of this that we can help you with, please don't hesitate to reach out to us. Thanks, everyone, for your time today. Again, you can join us again next quarter for this webinar, as well as look at this on our YouTube page. Our YouTube channel. There is Source IT Healthcare has a webinar, and then all of the back webinars that Joe's recorded to date can be found on YouTube. As I said, I'll leave this open for another 5 minutes or so in case anybody has any last-minute questions. Otherwise, we look forward to engaging with you guys over the next quarter and having this discussion with you again in 3 months' time. Thanks a lot, everyone. Have a great afternoon.